Hi, my name's Lindsay, and today we'll be presenting on driver rehabilitation programs and their impact on an individual's overall quality of life and independence. I will be looking at the perspectives of different patient populations as well as the various assessment tools utilized in these programs. So, the first question I'll be answering is: how do driver rehabilitation programs, such as the one offered by Marion Joy, contribute to an individual's sense of independence and overall quality of life? So, to start, it impacts an individual's quality of life because driving provides community access and mobility, which is grounded in an individual's independence, spontaneity, identity, choosing what they want to do, and all of that stuff. It's kind of like their sense of autonomy. And it also affects other areas of occupation, including IADLs, education, work, leisure, and social participation. There's just less overall involvement in those quality of life activities, such as like visiting friends as well, golf, pickleball, going to the movies, church, visiting the senior center, community events, just even going to like the library or something simple, maybe going to pick up some groceries. Those things are all impacted by not being able to drive. You have to figure out how you're getting there, how you're getting home, how you're getting those items home from the store, and everything is just much more complicated. Driving also enables participation in activities a client wants and needs to do. So again, like those IADLs and work is something that like they might need to do, whereas their leisure and social participation is more of what they want to do. And it was also reported that older adults who do not drive are 15% less likely to go see a doctor. So this is also impacting their physical health as well, which also impacts their overall quality of life. And then driving retirement can also lead to isolation and depression. So that would overall affect their emotional well being. And driving is just the highest level of independence. So it obviously contributes a lot to it as well. And then, so what do these programs do specifically? They explore the possibilities and steps towards helping clients to return to or start driving. That could include achieving or earning their driver's license, as well as they evaluate and educate to increase independence, quality of life, and safety. And they do this for various patient populations. They do this by assessing a client's visual, motor, and cognitive skills for safety. They even go behind the wheel with clients and utilize vehicles that they adapt to fit a client's specific needs. And then they send these recommendations to a referring physician, and then they work with local vendors to get the equipment needed for the client's vehicles. And if driving retirement is the end result, they will provide resources and provide an implemented plan for the client to utilize for improved community mobility and transportation. And now I will just be moving on to the perspectives of different patient populations. So, first, I will just be discussing strokes. So, if an individual suffers from a stroke, their deficits can definitely interfere with driving. This can include hemiparesis, hemiplegia, visual limitations, memory and attention deficits, slowed reactions, impulsivity, decision making, and so much more. There can be deficits in each of the areas, including visual, motor, and cognitive. And then, so the intervention should definitely focus on those skills as they're each needed for driving, such as scanning for pedestrians or signs, motor skills of like hand over steering, bilateral coordination to activate the turning signal while also staying in the lane, and just paying attention for the entire duration of the drive, to stoplights, stop signs, construction, changes, and stuff like that. The equipment that is needed definitely depends on an individual's functional strengths and their impairments. As we know, that can vary depending on where the stroke occurred, their age, and so many more things. But if they cannot steer with both hands, then a driving rehabilitation program can add a steering aid, which can be used to assist with steering, and then they can just use one hand, while also operating the car with one hand as well. And then if paralysis is in the right leg, they can add a left foot accelerator, which could be appropriate. And I included a picture down below of that kind of being used. They can also add extra mirrors, which would be adapting or compensating for those visual deficits as well, just giving them more overall look behind them and to their sides and stuff. So these interventions should definitely tailor towards these cognitive skills again, just to ensure there's safe decision making and judgment. And if those improvements are not made and they cannot drive safely, then an OT can help to provide a plan, resources, and alternative transportation options. Although they would definitely have to like practice that with them as well instead of just giving it to them, to ensure that they are achieving that quality of life and engaging in those meaningful activities as well. So, the next patient population I will be discussing is spinal cord injuries. It's important to note that with spinal cord injuries, it's also common to see traumatic brain injuries, even if they are undiagnosed or mild. But these deficits can still impact driving, and they include attention difficulties, irritability, and executive functioning challenges. And it's important for the occupational therapist to assess for these deficits as well. And for functional outcomes and equipment needed for the driving rehabilitation, it depends on which key muscle groups are functioning and if the injury is complete or incomplete. So, with a C5 spinal cord injury, they may need to drive in their wheelchair, and this will be possible with a lowered floor minivan ramp. And this will just help them to get up and down the ramp without having to do it themselves. So, using that kind of technology to bring the chair in and out, and they can use a high tech one arm driving system, and this is a system that controls the steering, gas, and brakes all with just one arm. I included a picture of it down below, but it's important to note that this system is around $100,000, and that's very expensive and not very accessible for majority of people. But it is a great system and very adaptable. So the next one is a C6 spinal cord injury, and this is likely to require a modified van with sensitized steering, so it's just easier to steer, hand control, so they don't need to control the gas and brakes with their feet. And these can typically go by the steering wheel or under the steering wheel. And they also might potentially need a powered seat base. And this is just to kind of preserve that upper extremity just function and strength overall. So this will help them get in and out of the van with much easier than having to transfer themselves. So then with the C7 and 8 spinal cord injury, this can typically they can typically use the mechanical hand controls, and they can also transfer to the driver's seat, so they won't need those adaptations. But the interventions are more likely tailored towards just easier dismantling, loading, and unloading the wheelchair. This is important for their independence when they're out safely, and especially in a variety of different weathers. But also, if they're with their caregiver and they're constantly making them do it, it's going to wear them down as well. So it's also protecting the caregiver. And then additional adaptations can just include pedal blockers so that the gas and brake is not hit on accident or anything like that. And upper torso supports, chest straps, and steering devices. And now I will just be going over the assessment tools used in these programs. So, for the assessment tools, they assess client factors through observation, patient parent interviews, and standardized assessments. Overall, they evaluate the client's visual, motor, and cognitive skills. So, they do the patient parent interviews to just kind of see the patient's level of independence, if they can stay home by themselves, cook by themselves, manage themselves at home, and then as well as the community to kind of see, which would give them a good indicator of their overall safety and if they would be safe on the road. And then more into the standardized assessments, they could do the short blast test, the trail making A, which is for 18 and up, and it assesses working memory, visual processing skills, visual spatial skills, and psychomotor coordination. I included a picture to the right. It's this white one here where they just connect the dots of the numbers in order. And then the trail making B is the same thing, but it connects alternating numbers and letters. So 1 to A to 2, 2 to B, and so on. And that assesses working memory, visual processing, visual spatial skills, selective and divided attention, and psychomotor coordination. And that one is also for 18 and up. That leads us to the comprehensive trail making test. This one's very similar to those, but it's for teens, so ages 15 to 17. Then there's the symbol digit modalities test, and this is a neurocognitive test assessing learning, attention, visual scanning, and motor speed. And the next one is just the Beery visual motor integration assessment, and that one's for teens. And then there's the clock drawing test, which is for non teens. And they'll have to draw a clock, and they'll say draw 10 after 11 and see their memory, visual spatial skills, visual perception skills, selective attention, and executive skills. And then the useful field of view is for 55 and up, and it's a computer based touchscreen assessment that assesses processing speed, divided attention, selective attention. And I included a picture down below, and it shows like a truck in the middle and then a car on the outside, and then it'll ask, so which one did you just see? And then I will have to tell them like which side did you see it on, and they'll have to click the spot they saw it in. And that one's pretty cool. And then they get more into visual perception with the motor free visual perception test. And this one is usually scored as a whole and not subtests, but it's for spatial relationships, visual discrimination, figure ground, visual closure, and visual memory. And then they'll get into the motor function where they will do assessments to see what they can do functionally. So, range of motion, manual muscle testing, coordination, reaction time, rapid pace walk, coordination, proprioception, sensation testing, and just overall reaction time and transferability, and etc. And then there is the behind the wheel evaluation, and this assesses a client's ability to operate the motor vehicle safely. It's typically a standardized routine with standardized instructions for all patients, but it can also differ with just different lights and construction or pedestrians as well. And then it observes again the physical, cognitive, and visual skills, but for example, for visual, it can include scanning for pedestrians, shifting their viewpoint, looking all the way down the road, judging speed or the distance, etc. And then for cognition, it can include their left and right discrimination, paying attention to the road, obeying and understanding the laws or signs, maintaining the speed, and just overall making good and safe decisions with good judgment. And then for physical, it could include transferring, loading the mobility device, operating the foot brake or steering the wheel, fastening the seatbelt, turning the key, and then stuff like that. But at the end of the evaluation, the driver will have a conversation with the client and their family, just discussing their recommendations, such as the equipment or if their driving should be restricted to the mornings or if they should just have some sort of alternative transportation plan put in place. And then here are just some pictures of the behind the wheel evaluation in the process of it. That's the end of my presentation, and here are the references provided.